As Molly just mentioned in his weekly address, President Obama claims an unprecedented consensus is forming for health care reform. He's citing support for and from GOP lawmakers and some Republican mayors and governors. What about Congress members, though? Bipartisan support in Congress is almost non-existent. In fact, a report in today's Washington Post says the bill may not get one single yay vote from House Republicans. So is this consensus for real? Kansas Republican Congresswoman Lynn Jenkins on the Financial Services Committee joins us. Also, Virginia Democratic Congressman Gerry Connolly on the Budget Committee joins us as well. Thank you both for talking to us. Not one single yay vote from Republicans in the House. Congressman Connolly, why is that? Are Democrats not willing to bend?
No, I don't think it has anything to do with Democrats. I think it has to do with Republican leadership that, just like on the stimulus, has decided in advance, no matter what's in the health care reform bill, they're against it. And that's a political move. Senator Jim DeMint of South Carolina at least was honest enough to admit that if we defeat health care, we break the presidency of President Obama. He referred to it as his potential Waterloo. That's what's going on. It's not honest. And it's really tragic for the country that the Republicans have decided not to play.
Well, are they really not playing, Congressman Jenkins?
Well, of course we're playing. We went to Washington to solve problems. That's why on day one, when I showed up in January, I was placed on a health care working group, a group of Republicans, and our task was to come up with ideas to solve the issues. And we have had a plan. It's been on my website for 3 months now. So it shouldn't be any revelation to the world that Republicans want to address the issue of health care reform. We just want to do it in the right way. We've watched time and time again Nancy Pelosi lead the Democrats down the wrong path the last 9 months, whether it was that stimulus package that has yet to stimulate the economy, a budget that triples the public debt, doubles spending in 10 years, a national energy tax that every American family will feel, to this health care plan. We need to do it right.
Congressman Connolly, okay, so you're just hearing from Congresswoman Jenkins, who says that Republicans in Congress, including Congresswoman Jenkins, are opposed to a lot of the Democrats' plan, but specifically the public option. They say that it's going to result in millions of Americans losing the current coverage. Nobody wants to lose their current coverage, and nobody wants to pay more, and Republicans say that it's going to add hundreds of billions to our national debt. Are there other options there to Speaker Pelosi's plan, the H.R. 3200, or not? Or is it just 3200 or nothing?
Well, let me just make it clear. I, for one, you're talking to a Democrat who has not endorsed H.R. 3200. Okay. I have some issues myself. However, I take direct issue with what the characterization of the public option plan. As the CBO, the Congressional Budget Office itself, has pointed out, that the public option contained in the House bill actually will save money and will bring down the deficit. And furthermore, the CBO costing of the Senate finance bill and soon the new House draft bill will show that it is in fact deficit neutral, as the president said it would be. Wait a minute.
I want you to tell us how it's going to bring down the deficit and save money.
I'm going to finish this sentence.
Okay, and then explain.
Just repeating it doesn't make it so.
Tell me how it's going to save money and bring down the deficit, because you got my attention.
Well, the CBO says that the public option could save $110 billion. The robust public option could save $110 billion over the 10-year period we're talking about. The public option is one option on the exchange of about 12 or 15 plans, we hope. No one has to choose it if they don't want. The CBO itself has said that at the most, a third of those who are currently uninsured might opt for the public option. 2/3 will opt for private insurance. So the notion that it will destroy the health care system and add to the deficit is simply false, according not to me or other Democrats, but to the independent, nonpartisan Congressional Budget Office.
All right, I want to be fair, Congresswoman Jenkins. I'm going to have you reply, and then we have to get going here.
Well, I couldn't disagree with my friend anymore. A government takeover of the health care system is the wrong direction to go. That's why Republicans have an alternative proposal. The plan that we are looking at on the House side has been scored. $800 billion in tax increases, $239 billion increasing the national debt. 23 million people will lose their insurance. This is not the direction my constituents here in the heartland want to go. They don't want the government taking over their system. They don't want a government bureaucrat between them and their doctor. They don't want denied or delayed health care. Let's do it right.
All right. Congressman Connolly, Congresswoman Jenkins, thank you very much for a fair and balanced debate. Appreciate you both coming on.
Thank you.